Advisory Committee on coronavirus, shared with us very well-informed insights on the coronavirus trends in South Africa and detailed South Africa's planned phases of interventions. We have since received a number of requests to translate key elements of this presentation and specifically unpack South African trends, strategy, and local preparedness for the benefit of those who missed the talk or for those who want to further understand certain elements of the conversation. And that is our intention today. I will be joined by experience having either treated patients or teams during this period, having been involved in creating COVID-19 related policies for medical advisory or risk management teams. And of course, we are all navigating our way through the business impact of coronavirus, as are many participants in this conversation. Today, we will share with you data from reliable resources. We will translate this information in a way that is relatable. And of course, we'll tap into our own personal experiences with coronavirus as well. So just in terms of the discussion overview and how we'd like to frame the conversation this afternoon, I will start by giving a global snapshot, really just looking at where we are in the world today with regards to the coronavirus pandemic. We will then zero in home, where I'll hand over to Dr. Swart, who will speak to South Africa's fight against coronavirus. And he will hand over to Dr. Leigh, who will look ahead and specifically speak to the impact of coronavirus on individual health and of course on general health care. We then invite you to a Q&A session. And so at this point, I just want to direct you to the bottom of your screen if you're joining us on Zoom, and you'll see a Q&A icon. If you can type in your questions, we will collate these questions and then feed them back to the relevant speakers at the end of all three presentations. We have an hour with you today. And so in the interest of efficiency, let's head straight into it. So I'm going to kick off, as I said, very rapidly, and it has spread very rapidly across the globe. This dashboard is updated by the World Health Organization, not even on a daily basis, but a number of times during the day. And today's snapshot clearly shows that globally, we are sitting just over 2 million confirmed cases since outbreak, with 77,000 new cases overnight and 1,000 or rather 135,000 deaths overnight. What's interesting is that I updated this dashboard at about 6 o'clock this morning. And when I came back at 12, just to have a look again, because this data moves very fast, I had to replace these images because that's how quickly this disease is progressing. And of course, the data is being updated. If we compare regions, we see clearly, and this shouldn't be news to you if you're following, of course, the news, that Europe and America are the worst affected regions in terms of caseload. And it is believed and it's speculated, and what we also know is that we are constantly learning about coronavirus, its influences, triggers, trends, as the disease, at least as the pandemic progresses. But it is speculated and it's believed that Europe and Americas have the highest caseload for a number of interrelated reasons, which include but aren't limited to factors such as initially, probably the greatest number of imported cases, perhaps a matter related to ecosystems which lend themselves to rapid spread. So that relates to individual and public risk factors. And perhaps importantly, a slow response by governments in terms of introducing effective containment measures. If we zone into Africa, only 0.6% of all global cases are in Africa, although 45 out of the 47 African regions do indeed have confirmed cases of coronavirus. But what we have seen in the African continent and in the African response in general is very proactive behavior by governments who have been very quick to introduce strict containment measures. We've seen that in first world countries, poor communities experience disproportionate share of the coronavirus disruption. And here I'm speaking about morbidity, mortality, and certainly what capacity of healthcare. And lastly, but certainly not least, the economic fallout that we expect as a result not only of the disease and the health implications, but certainly because of the economic impact of even the containment measures. Many African countries are still in the very early stages of organizing their responses in terms of focused and prioritized efforts, and are making the most of this limited time and certainly limited resources available. So to zone it right into South Africa and the point of our conversation today, at this point, I'd like to hand over to Dr. Jeroen Swart.
Thank you, Phatho. Let me just share my screen and then we can get going. Right, there we go. So most of you will probably have seen this slide already. This was presented by Professor Karim and the other experts to the South African population via TV, YouTube, and other media a few days ago. And what they discussed was our current epidemic trajectory versus the UK and other countries. And if you look at this slide, you can see that the UK has had a similar trajectory to what many other countries have had, where initially they have a doubling in cases every third day, which would be this line, or every second day, or every fourth day. And they initially followed that line, and eventually various measures start to deviate the line from the original trajectory and flatten it. We've had a very different response, where we initially had quite a similar increase in case numbers, and then suddenly it's deviated away from that line. And a lot has been said about that in terms of the lockdown, which we currently find ourselves in. And in fact, at the presentation earlier this week, it was attributed to that. This morning, however, Professor Karim acknowledged that it may not be directly as a result of the lockdown. And I'll speak a little bit more about that in my following slides and some other interesting numbers. So this is the same data, and you can see that initially we have this exponential increase. So this is a linear scale on the y-axis, and this would go into a very steep curve, which makes it very difficult to actually see what happens after a while. Hence, we use the other curve that you saw before. This is the intervention of the lockdown. And after that, you can see this change to this flattening of the curve. Now, one of the important things to know is that the time that the cases become identified is when the results of the PCR screening become available. And that typically happens about 15 days after the person falls, or actually contracts the virus. So there's about a 15-day delay, and it varies depending on the circumstances. And so going into lockdown at this point is unlikely to have been the cause of this change in the curve. And in fact, this morning at 7:30 during his presentation, Professor Karim actually acknowledged that 20 cases and has been fairly low until the last few days, where it's risen again. Now, any intervention that we have is unlikely to show a sudden dramatic change overnight. It's more likely to change over a curve and slowly decrease. So there's this sudden decrease, which we need to understand. If we look at the number of tests that were conducted on a daily basis, you can see that initially that also increased exponentially. And the majority of these were tests that were being conducted by private laboratories around the country as a result of people attending healthcare, includes the government's own labs from the National Health Laboratory Service. And if we look at the NHLS tests that are conducted, that's in 9 laboratories around the country. And these are the tests conducted by government. And this is the 27th of March. And we can see that their tests actually continued to ramp up progressively. So if we factor that these were increasing, then this sudden drop from over 5,000 to approximately just over 2,000 means that in the incubation period, typically before the person falls ill symptomatically, it's normally about 5 to 7 days before they become ill enough to seek medical care. We've already passed these first 3, so we're now in lockdown. The next strategy would be to move from a lockdown into what's going to happen afterwards. And what's likely to happen after the lockdown is that this scenario. So here we buy ourselves time with the lockdown and we flatten the curve. But after that, it's likely that cases will continue to rise, and we will have an 29 of them actually came back with a positive PCR test. So that actually equates to 0.02% of the individuals screened came back as positive for COVID-19. This morning, Professor Karim announced that they've actually conducted over 1,000 identify using the community healthcare workers hotspots around the country, and then basically send in teams to identify cases, the contacts, tracing them, seeing which of those become infected, and obviously quarantining them until the outbreak in that particular area is brought under control. Other factors that they want to do in the time that they've bought is improve medical care, get PPE equipment for healthcare workers, increase the number of available beds and ventilators and other factors to get ready for when we eventually get to the peak that we're bound to see. An important aspect is looking after the families of people that have passed away, unfortunately, as a result of this viral infection. So helping them in terms of the burden administratively and also psychologically and socially, the impact that that has on families and communities. If we just go quickly back to those daily confirmed cases, this is from today. And so an important aspect that needs to be addressed is, so we saw this drop off. What's likely happened was more of this sort of a curve with a slower drop off, and that this gap here is due to the sudden drop in testing, and that these numbers here more accurately reflect the number of cases. And these are cases that were from people who were originally infected from travelers. So these are people who then reported to their doctor and basically presented passively with the disease. The new community healthcare worker screening means now the government is going out and actually searching for cases. And as a result of that, the yield from that has resulted in the last few days. So this is when they started that community healthcare worker screening intensively. And obviously it takes a few days for the test results to become available. So what we're seeing in the last 5 days is now a cumulative number that includes, it's a mix of active cases being sought from the community healthcare worker screening and passive cases that are still presenting. Now, those figures of under 90 per day are currently being exceeded. And I think it's probably likely that the government needs to reevaluate what their targets are. Our test is a swab taken from the back of the throat or the back of the nose. And that swab is then taken to a laboratory where a test which takes approximately 6 hours to run amplifies the RNA by doing a PCR test, polymerase chain reaction test. It's an expensive and difficult test to do. Reagents around the world are in short supply, so there may be a cap in terms of the capacity on that. And so these finger prick IgM, IgG tests look for antibodies that you've produced in response to an infection. And for COVID-19, the IgM, which is one of the types of antibodies, rises on day 7 and is measurable on day 7, whereas IgG is measurable on day 21, so 3 weeks after infection, and IgM has declined then. This is typical of all IgM, IgG responses to various different infections. And those finger prick tests will then allow the government to identify cases that may not have come to their attention because the person was either asymptomatic or just didn't go to hospital even though they had symptoms. And in that way, we can identify where the disease is actually taken. Because we went into lockdown early, we've been able to slow the epidemic quite considerably. That means we probably will also have a shorter lockdown than in countries like Italy and Spain, where the epidemic was rampant before they entered the lockdown. The current trajectory is curtailed community transmission due to those early interventions, but eventually we will have that exponential rise. The lockdown has bought us time, and that'll reduce the peak load. And that means that hopefully our medical services at that time, after being mobilized, with hotspots popping up for at least the foreseeable year, maybe even longer. It may even take a few years before this epidemic is fully brought under control. And exactly how severe those hotspots are will determine how much social distancing we'll have to do and whether or not there'll be repeats, maybe in areas where we will have lockdowns, which will then be released once those little hotspots are brought under control. And once a vaccine and treatments become widely available, that will progressively bring things under control. But we can expect certainly a good deal of time before we get to a point where this epidemic is in any way behind us. So we still have a lot to get through before that time. And on that point, I'll end, and I'll hand you over to.
And a day-to-day perspective for most of us, what's it going to have an impact on? How is it going to have an impact on us, on our day-to-day lives? And that's what's really difficult. And there is no data for us to base this on. It's a question of, we can tell what's going to come ahead from what's gone before, but a lot of it is forecasting, common sense, and reading what's going on in life at the moment. So I'm going to have a little think about what's lying ahead. How will our lives be affected in different spheres? Will our health behaviors change? Will the risk of certain individuals change, their health risks? And should it change? Should we be changing our health behaviors? And the question is, will healthcare change? Should it change, and how would it change? So first of all, after lockdown, what's going to happen? Obviously, one of the major consequences is the economic implications for the lockdown. So from a business perspective, there are going to be a lot of implications after this. We've already seen a lot of movement towards online platforms, be that online shopping, but mainly for businesses, the use of online platforms for businesses, for meetings, and that things are going to change massively onto an online platform. And we're already seeing the use of Zoom and Teams being used for meetings. And one of those issues is the safety of certain platforms. So we're going to need to have a look at that. There's obviously a lot of online shopping going on for a lot of people. Travel, how is travel going to be affected? Massively. I mean, we can already see that how airlines have been affected, and a lot of non-essential travel will be curtailed. So that will have implications for both the tourism industry, for business industry, hotels. So that has a huge implication. Are gyms going to be open? Possibly that will be part of a phased reintegration into society. So we don't know. So we need to look at different ways of sport and health. Schools, there's some talk about yesterday's governmental meeting that different grades will be phased in at different times. And schools are implementing remote learning, home learning, which obviously puts a lot of strain on people who are working at home, working parents who are having to facilitate their children's studying as well. So that obviously adds to the stress of this whole crisis. Universities and colleges have indicated that they won't be going back before mid-year, most likely. And there are lots of reasons for that. Obviously, there are large gatherings together. If you have residences and you have someone who develops COVID, that will be a hotspot and a fire waiting to happen. So we are trying to, there are a lot of factors to when travel restrictions will be lifted and the impacts from large gatherings, how many people are allowed. So there are a lot of factors that are going to come into play for these decisions. Provincial competitions may be postponed or cancelled for the year, as will club competitions, and we're not quite sure what will happen with school sports either. So there's going to be a huge impact on sport after lockdown. We can't expect that it's going to go back to business as usual. So the next thing we're going to talk about is individual health behavior and risk, and is it going to change? So on the screen, you'll see the two major behaviors that are changing that we can see outside at the moment. One is social distancing, and two is the wearing of masks. So the government has, in the department this morning, released figures from their flu tracker that has shown a massive dip in their seasonal flu, which is great as long as it, one of the questions was that, well, if you reduce your flu now, you lose the potential impact of herd immunity, and are you going to get a rebound later on? The answer to that is why we have flu vaccines, and I'll chat a little bit about that later, but we can prevent flu with using flu vaccines. So that is a positive. What are possible negative consequences that might be exacerbated by the lockdown and being on their own? Depression, anxiety might all be aggravated by this whole situation, and we need to be cognizant of that. Also, with the lockdown, have people exercised as much? And in thinking that exercise is medicine, what are the consequences of not exercising as one should have? So, and if we look at people who have chronic health illnesses, the lack of exercise might have severe consequences on them. So there are a lot of things that might change as a result of the lockdown. And then we need to think about that, how we can impact on that going forward. So if we think about masks, so unintended consequences of masks. So obviously there's a great opportunity here for a lot of entrepreneurs who are now developing all different shapes, sizes, and colors and designs of masks, which is awesome. And there's certainly a lot of entrepreneurial activity going on at the moment. But as I mentioned just now, for the reduced spread of respiratory illnesses, let's look at the very possible great outlook that we live in the Western Cape, where there's a very high prevalence of pulmonary TB, which is spread by droplet spreads for those who have reduced immune systems are at risk. What happens if by wearing masks, we unwittingly drop our transmission rates of pulmonary TB dramatically? Wouldn't that be just a phenomenal outcome with this whole situation? So there might be positive consequences, possibly some negative, but generally we are hoping for all positive from social distancing and mask use. So how is behavior going to change? I can't see that large gatherings are going to restart soon after lockdown, and we need to consider the possibility that sport will be played behind closed doors and that large gatherings will be prohibited for quite some time. Now that number might change, but I think that is going to be a reality going forwards. And when one thinks about that, if one thinks about a rugby match, it's not just playing the match with no one watching. One has to think, how many competitors are there? What is all your support staff that you need? What are the security staff? What are the medical staff? And all those people all need to be considered in terms of a gathering. So it's not as simple as one imagines. Flu jabs this year are going to be really, really essential, because we need to try and reduce the risk of people getting ill from a preventable cause. So can I urge everyone to please get your flu jabs as soon as possible. Hand washing, we've already seen that behavior has changed very dramatically. You can't go anywhere without having alcohol, hand sanitizer. So you go to the shop, I think we counted yesterday going to the shops, we had hand sanitizer at least 8 times from leaving my car to getting back to my car. And then how is exercise behavior going to change? And should it? And if so, for whom and why? And if you've been sick with COVID, is this going to make a change as well? So, and these are all factors that can be discussed. But my most important point for today is that it is really important that everyone needs to continue exercising, because we're all in the sports and exercise medicine game. We know how important it is. So it feels like I'm preaching to the converted. But there are a lot of things that go around safe exercising. One of them is if you're going to be exercising in a gym, all the cleaning protocols and spacing protocols that CISA has obviously implemented before lockdown, but those will need to be considered. And remember, if you're running outside or cycling outside, you need to consider that there's a safe distance around yourself, because your droplets that you're coughing or sneezing out still hang around in the air. So you can't ride or run in groups, because one is still putting the people around you at risk. So why is it important for certain people? Because we know that the risk of severe disease in COVID and the risk of mortality goes up with age, and especially if you've got other medical problems. And those medical problems are chronic heart and lung diseases and diabetes. And for all of these, exercise is medicine. So you need to consider exercising to maintain your treatment, if you want to put it that way. So if we haven't really looked at any clinical data, but essentially 20% of people who get ill with COVID develop severe disease. So of every 100, about 20 are going to need to go to hospital, And of those, 25 will probably need to go into ICU. So those are the numbers that we're looking at. So we're trying to reduce that risk of severe disease, and obviously the mortality that may go with it. So one of the reasons for exercising, there's some research that was published yesterday in a neuroscience journal that one of your antioxidants is released in even a single bout of exercise, and it appears that that antioxidant may protect you against the progression into severe disease, especially lung disease. So there's definitely evidence out there that exercise is you know, you need to continue exercising. And most of all, I think at this time, remember that exercise is good for your mental health. So on so many different levels. So my last question that I want to address is healthcare going to change? And if so, how? I think we're going to see massive differences coming up. And I've tried to look at this from a doctor, patient perspective, medico-legal, medical aid, and public-private partnerships. I think from a doctor and a patient perspective, we need to realize that both doctors and patients are much more aware of their own risk in terms of personal protective equipment. I think it's going to change the way we look at accessing healthcare. So whether that healthcare can be accessed online or virtually. And that has implications for medico-legal, because medico-legally, our regulatory body initially said that only virtual consultations would be allowed for psychology assessments as opposed to medical assessments, but that has been changed for COVID. So from a patient perspective, I think it might depend on socioeconomic status as to whether your access to healthcare changes. You know, we have very quiet GP surgeries in the suburbs, and we have long queues of patients at hospitals waiting for their medications. But we also have free helplines where patients can access healthcare for free online. So, and that is being financed by a lot of the platforms such as Discovery, Vodacom, and certain of the medical aid. So one of the other things from a medico-legal perspective is looking at the insurance, how the insurance industry is going to change. That involves medical aid, but also insurance for income protection. You know, if you are quarantined because you've been in contact with a case, is your insurance going to cover you as opposed to whether you've actually been sick with COVID? So there are certain different things to contemplate there. And then from a public-private partnership, I think this is going to be one of the biggest changes that we've already seen, that we're having partnerships being developed between the public hospitals and the private hospitals, that there are agreements that patients will be admitted into both should the number of beds be limited. And I think partnerships like that are only going to increase. We've had private hotel groups coming on board offering vastly reduced rates for healthcare workers should they require isolation and they can't isolate safely at home. So there are very definite partnerships that are developing. The question is, how will hospitals change? Are we going to need new hospitals? We've seen in Europe and in the States that they are essentially building field hospitals, what it looked like in the war. And that's kind of what this feels like. Are we going to war against this virus? So certainly in the UK, they are building field hospitals in old air hangars, and they're redeploying a lot of the GPs into those field hospitals. So there's a lot of changes that potentially could happen, and that will all depend on whether that surge is going to occur and how big it's going to be and what our peaks are going to be. So it's very difficult to forecast exactly what's going to happen and what those numbers are going to be, but these are all the factors that are going to have to be taken into consideration. So I haven't had the benefit of working on stats and data for my slides. It's been more what do we expect and a little bit of a crystal ball, the corona crystal ball. So not sure what to expect, but thank you very much all for listening. And I think part 2 will be opening for questions and answers.
Absolutely. Thank you very much, Leigh, and thank you very much to you too, Jeroen, or should I say Dr. Gordon and Dr. Swart. At this point in time, I will be heading to the Q&A section or part of our webinar. And I invite you again to just go down to the bottom of your screen where you see a Q&A icon and type in your questions. So let me kick off. The first question that we received related to CISA and to our ever committed members. As Leigh said, we often preach to the converted, but so our members are asking, what's our plan for opening the facility and certainly the gym again? Just briefly, the indication really is that government is going to follow a phased approach to lifting the restrictions after lockdown. And so firstly, we need to understand what the implications of these different phases are on entities like our own, and obviously be guided on that. We have been proactive in our management around coronavirus as an entity. And you saw that before the lockdown happened, how we had our own sort of risk assessment team. We evaluated the local factors and certainly the factors related to our own ecosystem as an entity. And similarly, we will do the same once lockdown is lifted and assess local, when I say local, Western Cape factors and certainly our own ecosystem factors in deciding on a phased response. But the reality is we'll probably be a phased response to opening, where we look at things like one-on-ones first, limiting groups in the gym and obviously capping numbers. The context here really is, other than the government mandated regulations and restrictions, which we must adhere to, we know from Jeroen's talk and from what we know in the evidence is that we're not likely to see a cure for coronavirus in the next period. And so it will remain a threat and a risk. And so we must continue to manage this risk within our ecosystems as we return to business. The second question that I'd like to tackle is a question from an anonymous attendee who asks if we can just explain what makes this virus so unique. Specifically, there have been comments about the flu virus killing more people annually. So before I just add my comments, perhaps Jeroen, I should invite you to address this question.
Sure, thank you, Phatho. The answer is there are three main factors that make it different to influenza. The first one is how contagious it is. If you look at influenza, the typical person with influenza, and that relates to the clinical term R0, that's the number of people that you infect if you yourself are infected. And for influenza, that's about 1, which means that on average, each person who gets the flu spreads it to one other person. And as a result of that, flu tends to spread quite slowly throughout communities. Now, for coronavirus, the R0 value is over 3. And as a result of that, that means that you have exponential growth. If you've got a R0 of 1, it means you've got a linear growth. If you've got 16 people infected this week, by the time they've recovered next week, you've got another 16 people infected. With corona, if you've got 16 people infected this week, next week, you've got thousands infected. So it spreads at an exponential rate. So that's the first thing. The second important factor is that corona has a period where the individual is asymptomatic but able to infect other people. And from the data, it looks like that's a period of about 4 to 5 days before the first symptoms appear. So people who are infected are walking around in the community and spreading the virus before they're aware of that. And in addition, a certain percentage of people don't have any symptoms with a coronavirus infection. And currently, based on the number of studies, the estimate is somewhere between 15 and 50% of people. And so there could be a very large percentage of people that are walking around infecting people, what we call super spreaders. And in Korea, for instance, there was an example, one case who spread the virus to over 1,000 different individuals. So that makes it particularly a problem. And the last factor is how deadly it is. The typical case fatality rate for influenza is 0.1%. And for corona at the moment, it's 3.2 or 3.3%, so 30-fold more deadly. So if you combine all those three factors, it means that you've got a virus that spreads incredibly fast and is, in relative to flu, incredibly deadly. And if you take, for instance, some numbers into account, if you look at, for instance, New York City, that's a city of 8.5 million people. And at the moment, you've got 1,000 people on average dying every day there. Now, in the US, you've got another 45-fold times that number of people. So if you had an equivalent infection to what's happening in New York City, happening around the US, you would have 45,000 people dying on a daily basis at this point in time. Now, the total number of flu fatalities on a yearly basis in the US is approximately 80,000. The coronavirus, if left unchecked and spread across the USA, for instance, would kill in 2 days the number of people that are killed by influenza in any given year. And if you continue the infection for many months, you can imagine that the numbers easily get into the millions, as opposed to in 80,000, which is already a very drastic number of people that could die in any given year from influenza. So influenza is nothing to joke about, but coronavirus, if we didn't take all the measures we are now, would be an absolute catastrophe. So despite all the measures that we've taken, it's still causing tens of thousands of deaths around the planet.
Thank you very much, Dr. Swart. The third question we have is from a participant, Dion Bester, who asks, what type of impact do you envisage if there's an increase in the infection rate in the high density areas, i.e. informal settlements? And perhaps, Dr. Gordon, I should direct this question to you to start the conversation.
Thanks very much, Dr. Zondi. So I suppose this is what we are trying to avoid, is that we are trying to avoid the disease going up at an exponential rate in high density areas. And we know that in the high density areas, it's difficult to police the lockdown in terms of social distancing. And in a lot of settlements, it's impossible to social distance as opposed to what is being advised by the government. From a practical perspective, if you have the illness, to isolate yourself with your own bathroom, that's not a practical option for a lot of people in the settlement. So that's a very difficult question to answer in terms of how it's going to work. But we do know that this is what we are really trying to work towards. And what our lockdown period has done is it's bought us time so that we can, when that problem hits, because I think as Jeroen alluded to, Dr. Swart alluded to in Professor Karim's talk this morning, that exponential curve is going to happen. So we are going to see increasing numbers. And what our lockdown has done is it's bought us time to be able to prepare for that. It's given us time to put in place the measures for screening. It's put in place measures for giving us time to bring in all the components that we need to try and deal with a high infection rate. So that comes from bringing in enough protective gear from overseas. And what people don't think about is being cancelled and the embargo on travel restrictions is that's actually had a massive influence incoming items that we need to fight this virus. So, and those items might include PPE, the masks, the gowns, the respirator masks, as well as reagents for all the testing kits. So what we've done is we now have time to get all of those together so that when we do have high numbers of people, that we are able to trace them, we are able to test them, we are able to treat them. And in terms of the measures that have been put in place in terms of partnerships between the public hospitals and the public and private hospitals, we are making room for beds should those patients need admission. Because really this whole thing is, the whole point of the lockdown is so that we give our healthcare system time, that it is not completely overwhelmed when those high numbers do hit. I hope that answers your question.
Absolutely. Dr. Swart, Dr. Gordon, Dr. Swart, do you have something to add to that particular answer?
Yeah, I think just in terms of what might happen in impoverished communities, is the important thing to address there is that people who live in those communities often don't have the ability to self-isolate and to distance themselves from other people who might be infected. And so one of the important strategies is to create areas where those individuals can seek solace from the infection and self-isolate. And a number of different of the provinces are busy creating these zones, which are effectively makeshift hospitals, where people who are infected and who don't otherwise have the ability to isolate, or who may need more treatment when other hospitals start to fill up, will be given the opportunity to go to those centers. So that's one of the strategies. And then the other thing is to be able to identify those areas where the virus starts to spread. The community healthcare worker screening program will be key in identifying the infected areas before they get out of control, and going in there and aggressively helping to isolate cases and treat those people who are infected will be the government's main strategy in preventing the infection from raging out of control and overwhelming us.
Thank you very much, Dr. Gordon and Dr. Swart. Two additional questions, and perhaps just in the interest of time, it might only be those, but we have a question from Facebook from Madonna Vadi, who asks, the swimming community, and I'm going to direct this to Dr. Gordon, but Dr. Swart, maybe start with the first answer. The swimming community are considering teaching swimming from early next month. So that's from May when the lockdown is lifted. What are your views on this, considering that chlorine kills corona? So let's answer that in two parts. The first one I'm going to direct to Dr. Swart. So is there evidence that chlorine kills corona? Just that answer. And then the latter part of the question, just your opinion, Dr. Gordon, on the swimming community starting swimming next week. I'm
not aware of any studies that specifically have looked at the effect of chlorinated water on the survival of coronavirus. It stands to reason, because of the effect of chlorine on other organisms, that its survival in chlorinated water would be quite short. So theoretically, there is possibly a safe area there in terms of the effect of chlorinated pools, but it still needs to be validated, and I haven't seen any evidence to support that yet. And hopefully somebody comes out with something soon to confirm whether or not there is a risk.
Thank you. Over to you, Dr. Gordon, to the second part of the question. So what's your opinion on swimming resuming from next month?
So I suppose early next month would be after the lockdown has ceased. So presuming that the lockdown will be lifted, I foresee that there will be phased integration, and certainly, as I said, exercise is going to be important. The issue about swimming is going to be, I think it's not the pool as much as everything around the pool, is that one has to remember that you're still going to be touching, you're going to be in change rooms, you're going to be showering, you're going to be touching taps, you're going to be using bathrooms, and all of those surfaces and doors and door handles are still going to be potentially sources of transmission for the virus. So I think if we leave the pool bit out of it, actually, and the exercise bit out of it, we need to consider that, it is still an area where potentially high risk for transmission. So one would need to be careful about decontaminating all your high touch surfaces and your high volume surfaces. So really the same as a gym. Thanks.
Thank you. I see that one of the participants, Stephen Ball from the University of Pretoria, has posted a reference on coronavirus swimmers and the risk of transmission. So I can direct all the attendees to please just have a look at that link for more information. Just really quickly, two questions that I think are quite important. The first one from participant Kanya on Zoom, who asks, what does one do in isolation other than hygiene and healthy eating? Is there any medication to follow, and what regimen do they follow? So I will perhaps take a stab at this question just to start. A really important question, Kanya, because at some point, very many of us are going to get coronavirus, and it's important to understand what we need to be doing. So the first thing, obviously, is to just protect your health. And you protect your health, really, as you've correctly said, by good nutrition, by allowing yourself enough rest. And at this particular point in time, where there is no treatment for coronavirus, what is being done is symptomatic treatment. So for the fever, paracetamol as example, and really treating those symptoms that are making you uncomfortable. It's also really important to monitor the symptoms. And what I've seen anecdotally, of course, is people saying, write the symptoms down, because if your disease unfortunately progresses, oftentimes you also get confused, you lose track of time, and you might forget the symptoms that you experienced, and therefore the cumulative symptoms. So that becomes important also, to just keep a record of your symptoms. It's really also important, specifically if you live by yourself, to make sure that somebody knows that you're not well, so that somebody can check in on you, all right? And I'm talking about even in mild cases of illness here. Make sure that you inform people that you're not well, so that somebody can check in on you and make sure that you are recovering, or that you seek help when you need to, or is coming to drop off food for you if you need help dropping off food or support in that particular way. And of course, also making sure that you've got a community ensures that, just from a mental health perspective, that you keep connected, and that you've got people who will just keep you boosted when the lows get very low. So I hope I've addressed the question in terms of what you can do. In terms of regime, it depends on the symptoms that you have and the extent of the symptoms. Obviously, will inform what you can and can't do. Some people feel well, some people feel quite uncomfortable, and so they just want to sleep for most of the day. And I hope I've addressed your question in terms of medical or herbal supplements, and really it's a symptomatic treatment. We are running out of time, so I'm going to close it there. Just two additional questions. Perhaps one is, do we feel that the lockdown period is enough to buy us more time, or does it need to be extended to have a real impact? Time will tell. And so I know that there are very clear indicators that the Ministerial Advisory Committee have, or markers that they've put in place, epidemiological markers related to daily rate of confirmed tests specifically, and other markers that maybe Jeroen you can speak to in 30 seconds. And really what it won't do is, as we said, it's not going to be enough to stop and see us decreasing indefinitely that curve, because at some point we will experience the spike. But what Leigh has emphasized, or Dr. Gordon has emphasized, is hopefully by the time we lift lockdown, whenever that is, we will have enough time to prepare our healthcare infrastructure and our resources. Perhaps in the interest of time, I am going to take that one last one on hydroxychloroquine by Dr. Racheb Fredericks, and then I will be closing the meeting in the next 2 minutes. So Dr. Swart, over to you. Can you comment on the use of hydroxychloroquine?
Yes, so hydroxychloroquine has been touted as one of the medications that can reduce the severity or the duration of infection. And there have been a number of people who've been treated using either hydroxychloroquine together with other antivirals or hydroxychloroquine and azithromycin, which is an antibiotic against bacteria, but has an effect on the replication of the virus. The first study was a small study that involved less than 30 people and was flawed because of the way that the two groups were balanced. And so there was really, in terms of interpreting the data, there needs to be a lot of caution. It seemed to be promising, but there's no definitive data to support its use. And so there are a number of studies around the globe now where it's being assessed as one of a number of different medications that could potentially have efficacy, but there isn't any substantive data that's been published yet. The danger with hydroxychloroquine is that it prolongs something called your QT interval, which is a measurement that we take on an ECG. But really what the QT interval indicates is your risk of having a fatal arrhythmia. And so it's a drug-induced extension of your QT interval, so a prolonged QT interval, and that can put people at risk for a sudden cardiac arrest. And there have been 1 or 2 fatalities that have already been reported as a result of the use of hydroxychloroquine to try and treat COVID-19. So at this point in time, the answer is no, people should not be treated with hydroxychloroquine until the evidence to support that comes out. I know that there's been a run on stocks of hydroxychloroquine in South Africa and other countries, and there are patients who have autoimmune conditions who desperately need that medication, and that people who are stockpiling hydroxychloroquine are depriving other patients who desperately need that medication. So please don't do that, and please be aware that it is an experimental medication and there is no evidence yet to support its use until we get good data to see that it actually is a benefit.
Thank you very much, Dr. Gordon and Dr. Swart. So I'm mindful of the time and I'll take us to the home stretch. The purpose of the webinar today was really just to unpack some insights that were shared with us from the Ministerial Advisory Committee for COVID-19 for South Africa, and then deep dive into the South African trends and influences on individual health and start exploring the impact that it may potentially have on healthcare. What we've seen is that the fight against coronavirus in these initial phases of intervention has been positive, and this really is a testament to conscientious and responsible leadership at the highest level in South Africa. The harsh reality, as we've all shared, is that we have not likely seen the worst of it, and we're still going to hit our peak. And so we need to prepare ourselves for this as individuals and certainly as a nation. Now that we've started these conversations, we will definitely continue with them, and we'll aim to do so on a weekly basis, hosted on the Zoom platform, and of course, live streamed to Facebook and other platforms. And so we invite you as participants to please share your feedback with us. We will send you a survey. Share your feedback with us. Give us an indication of what interests you or what you're curious about. and we will ensure that we gather the appropriate experts to tackle these questions and host the conversation. I want to thank you for participating in this afternoon's conversation and wish you a wonderful and restful weekend ahead. Thank you very much.